Great. My name is Pooja Mittal. I'm the Site Director for Maternal Child Health at the Family Health Center at San Francisco General Hospital. We're the largest FQHC in San Francisco, serving a pretty diverse patient population of about 12,000 patients. And we are here today to talk about PrEP. PrEP came up for me personally as a clinician when I was doing an immigration intake visit as a civil surgeon, and I realized that the woman that I was caring for has a lot of risk factors for HIV acquisition or any other STI acquisition because she had multiple partners and was having unprotected sex. And it was in that moment that I really realized that this issue is really applicable to all of primary care.
And I'm Robert Grant, and I'm a professor of medicine here at the University of California, San Francisco. And I led several of the PrEP studies. So I was really overjoyed when Pooja contacted us and asked for some information and an in-service about how to do PrEP. Mm-hmm. And it started as a 1-hour lecture for the residents, which I think went well, but people wanted a summary of, what are the bullet points, because they have so much that they have to think about in primary care. And PrEP is just one piece, an important piece, but one piece. So we, the family practice residents worked with me to develop this 3x5 card, which encapsulates everything I've learned over the last 15 years of research. And it's amazing that it all fits on two sides of a 3x5 card, but there it is. And it goes through the indications that are for PrEP that are recommended by the Centers for Disease Control and now the IAS USA and the WHO. And it's very broadly recommended for people who are not in a mutually monogamous relationship with a recently tested HIV negative partner, especially if they have any condomless vaginal or anal sex, if they have any diagnosis of a sexually transmitted infection or any positive partner. And generally, PrEP is very easy to provide. There are algorithms for doing it. There's just a few things that you have to check that make it more complicated, not impossible. If they have active hepatitis B infection or some concomitant disease that affects their kidney function, that requires special evaluation. But most people don't have those things. If they have an acute viral syndrome, then you worry that they might have an acute HIV infection, and we here send an HIV RNA in that circumstance. And the card really lays out who this is for and how to do it.
The thing that we really felt was useful about this card is the how-to, because a lot of our providers came to us and said, well, how am I really going to do this? How do I write the prescription? What is going to be the follow-up for this? So this card really goes through how to write the prescription, it goes through the key efficacy messages, and it also goes through how you do follow-up and monitoring. So that was a really important piece of this for us. And this card has now been through about 2 iterations and has been tested in our practice, and we found it really useful and are hoping to disseminate it more widely. Do you want to talk about that?
Well, and the card is available at the UCSF BAPAC website, and it can be downloaded and you can make your own cards. But Pooja, if you need help beyond the card,
you can always call the PrEP line, which is part of the Clinicians Consultation Network, and that number is 855-448-7737. It's for anyone to call, and the clinicians there can help walk you through how to start PrEP on a patient. There's also information at cdc.gov and a lot of helpful handouts and information for providers.
So any healthcare provider who has a license to prescribe medications can provide PrEP, and there are many people in the United States who could benefit from it. And we think this is one of the most important opportunities for ending HIV transmission in our communities, and we're very excited about it.